tonight we have with us once again, Robyn Brickel. Robyn, I think this is your third time with us, right? I think we had you really early in the spring, in the summertime. Robyn Brickel is a therapist who works in Old Town Alexandria. She runs her own practice. She has a group. How many therapists do you have in your group now, Robyn? I think you just hired somebody.
Five. Yeah, I don't remember.
Yeah, and so Robyn has just been a wealth of knowledge and a great support over the years. So I'm just very grateful for her expertise with helping me, my patients, and everything. But let's see. But they focus on trauma therapy, so trauma focused therapy. And so part of what we'll be talking about this evening is, so even though the mask requirements have lifted a little bit, it's still a little difficult. It can be difficult for people to actually feel comfortable going out and just doing the activities that we used to do. So we're going to talk a little bit about why that is, and also ways that we can potentially cope with that, and but also just talk about the mask requirements and sort of where we are with COVID.
Mm-hmm.
So
yeah, Cecily, what would you say patients have communicated the most fear about?
Traveling, I think is a big one. Traveling, I think, just lots of different things. I mean, it's sort of evolved, going into grocery stores, at first. I think that a lot of concerns about people who are not vaccinated, maybe being with other people who are not vaccinated,
Mm-hmm.
is a big concern.
Mm-hmm. Going to the gym.
Mm-hmm. That was considered a very high risk activity.
Mm-hmm.
And now it's,
should be fine,
it should
depending
be fine
on who's in your household.
Yeah, exactly.
Who you're going to come home to.
Exactly. So anyway, well, why don't we just jump right in and talk? So we received a couple of questions before the town hall. We're going to try to open things up at the end, just if people have other questions. But we will go ahead and just start. Can you tell us a little bit about the newest mask recommendations for both vaccinated and unvaccinated people? So we're going to try to screen share here. I don't know how well this is going to work, but we'll see. Here we go. Can we see that?
I probably have to take these chat bars out and this participant bar out.
There
How about that?
There we go. Okay. So anyway, Natasha, you want to run through some of the what we have going on here?
Sure. Whether you can see this or not, basically the green bar on the side is activities for people who are fully vaccinated. And you'll notice the simple way to read this chart is that all activities are a green light. So you can do what you want to do when you have been fully vaccinated, if, for kind of vouching for yourself. That means that if you're outside, you can go for a walk without your mask on. If you can go to a small gathering outside with friends, you could go to a large gathering, and you're still allowed to keep your mask off if you're fully vaccinated. Inside, you can also choose what your level of comfort is, and you're really allowed to do activities, whether that's in the grocery store or the hair salon, or that's going into an office building. You're technically allowed to do that without your mask on. There will be certain activities where people will still be asked to keep their mask on. For example, coming into our waiting room. So please keep your masks on when you're coming into the office.
A lot of doctors' offices, hospitals, acute care settings, even some nursing homes are going to require you to keep wearing masks for the time being. Mm-hmm. So that's something you should expect. And then also transportation, public transportation is still requiring people to wear masks. Mm-hmm. Flights, air travel. I think those are some of the main ones.
Yeah, and certainly we'd want to respect any office that is choosing to continue to keep their masks on. Cecily and I both have children in school, and we're glad that everyone's keeping their mask on inside with our unvaccinated children. So that's an example of a place where we're trying to keep the unvaccinated people safe.
Mm-hmm. So, and then you look on the other side and you can see a big difference between the right side, which shows the fully vaccinated people versus the unvaccinated people. And you can see that when you're not vaccinated, well, if you're not vaccinated, safest at the top to being outdoors. That was one of the, recommendations now is that outdoors, it's very unlikely if you are in an area outdoors without a whole lot of crowd, not in a crowded area, it's very, very unlikely that COVID can be passed. That's something that we've recognized. And so that's why the unvaccinated people do not necessarily have to be wearing masks outside anymore, which is good. But you quickly go down. If you attend a small outdoor gathering with fully vaccinated family and friends, again, somebody's not vaccinated, they're probably fine to be with you and be unmasked. However, then you start to go into attend a small outdoor gathering with fully vaccinated and unvaccinated people. So now you're starting to mix vaccinated and unvaccinated people together. Unvaccinated people should probably be wearing a mask. And then it keeps going down, dining indoor, even at an outdoor restaurant, indoor restaurant. It's so you can see examples of indoor and outdoor activities where the ones that are the safe and the least safe. And I think, something that we've alluded to a lot in the past is, everybody, even though we say that something is safe, when you kind of check in with yourself, it may not necessarily feel safe. So, and I think that it speaks a little bit to what we call windows of tolerance. And so this is a nice segue to bring Robyn into the conversation here. So Robyn, we've had questions that, I feel that the mandate was lifted too fast. How can I reconcile my anxiety about this? And why can't I feel safe without a mask on, even though the CDC and others are saying it's okay? Can you talk a little bit about why we're sort of having a hard time feeling safe?
Yeah, absolutely. I mean, I think that, right, 16 months ago or 16 months plus ago, we were safe. And then one day we weren't. And one day it was no masks. And the next day it was masks. And the guidance has changed so much over this time. And we're still learning. And I think, right, people have gotten anxious, right? Like if they already had anxiety, it's exacerbated. If they didn't, for some people, right, this has caused anxiety, right? Like this is the truest definition of trauma, which is a perceived threat to safety, to stability. And so in my mind, most everyone has had some traumatic experience as we go through COVID. And so it's just a matter of noticing your own comfort level, noticing, right, your own anxiety level, being able to kind of drop inside, notice where that's coming from, notice, right, can you be curious about that? Can you change that? Do you want to, right? There's nothing wrong with wearing a mask right now. I don't believe that anyone has said that. So if it helps you feel safe to start venturing out and then be able to work on that, get a little bit more comfortable every day. I mean, I can speak even for myself, for almost 16 months, we've been providing virtual care. And starting June 1st, we moved back to in-person care, providing care in a way in which it's safe, right? With, windows open and air purifiers, even though everyone on our staff is vaccinated, everyone who's coming in is vaccinated, but it's kind of been a nice place for people to dip their toe in, right? Like their therapist's office, who hopefully they trust to keep them as safe as possible and to deal with that. And just like your office, right? You walk into the building and you're wearing a mask. In the elevator, you're wearing a mask. In the waiting room, you're wearing a mask. And then only with some further discussion and comfort level, right? How do you feel? Because it's strange now, right? Like some people
it is really strange, isn't it strange, to suddenly, first of all, to see people's faces again, I think. So we just recently started, when we're in the room, the exam room, and it's just, the provider and the patient, having a discussion, are you vaccinated? And how would you feel if we weren't wearing a mask right now? I've had some patients say, I that's fine. Thank you. I can't wait to rip this thing off my face. And other people say, you know what? I don't know if I'm ready yet. And I think the key is also just listening, and it's okay. There's no judgment. And I think that's the other thing that's starting to happen now. People are looking at, who's wearing a mask, who isn't, why are you still wearing a mask? So this is, but I think that just being kind to one another and kind of meeting people where they are is sort of what we need to do at this point. It's what we needed to do this whole time, right? And now we're just kind of in the next stage of being kind to one another and allowing ourselves that that space.
Yeah, I think we're recognizing that our offices are a little bit of a teaching room. It's a little bit of a trial for people to kind of say, oh, okay, if my doctor's taking her mask off, it's probably okay for me to take my mask off. So, yeah, but I think that can be really a mutual decision. As Dr. Havert said, some people are not quite there yet. And so that's okay too.
Yeah, right. I think what you're saying about being kind is so important, and not just outwardly to others, but also to yourself, right? Like to be compassionate around that you're anxious and it doesn't feel okay right now, and to be okay with that. There is no judgment, right? To be able to just wear it when you're comfortable, right? That it's okay. You're vaccinated and you're working your way back to trying to feel calm again, feel some sense of safety.
Yeah, it's interesting. I mean, I think this is a little bit off topic, but what I've been feeling is that the pace is starting to pick up a little bit, just sort of and the pace, and I can almost feel, when we first had COVID happen, it's like everything came to a stop and it just felt, you could almost breathe, and now you kind of feel like things are starting to pick up a little bit again too. So I think that there's different anxieties that might be starting to come up, and not just should I be wearing a mask or not, but suddenly now there's maybe more expectations. People are, some people are being expected to go back to work. So there's a lot more that we're dealing with also right now that could also be adding to some of the discomfort.
Yeah, and I hope that we're going to also get today to really talk about what is scientifically safe, so that if you're wondering if you've read the guidelines right, we can hopefully confirm whether or not you have. I have lots of patients who are fully vaccinated, who live with family members who are fully vaccinated, and they're not yet going to the gym. And scientifically, it's really okay for them to go to the gym. If they're living with people in their homes who are unvaccinated, then that's a slightly different equation. Or if they're going to go see their 2-year-old granddaughter in 7 days, it might be smart for people to stay away from an environment like that for 2 weeks before the visit. But if they're only going to be interfacing at home with people who are fully vaccinated, then it's really okay to go engage in those activities.
But I think I also want to mention, though, that the chances of actually a vaccinated person having COVID and passing it on to somebody else is actually quite low. So the science does. So even though, again, that's sort of a level of comfort. Check in with yourself. If you are going to go visit your unvaccinated grandchildren, it may not be you might feel better if you didn't go to the gym that week. Although the science doesn't necessarily point towards the fact that is going to increase your risk of that 2-year-old or your grandchildren actually getting it. So
1 in 10,000, I think, is the statistic.
Yeah. And so so they're actually saying also that, and you saw that also in the table, that I think somebody wrote that they couldn't see the bottom, the scroll down. I'm sorry, we're kind of not great at the technical part of it, but what we'll do is we'll try to get a link. I'm going to put links to all of these in the chat, and so you guys can go and take a look. This is actually from the CDC. If you go to the CDC site, you'll see that. But you'll see also that unvaccinated people can hang out with fully vaccinated. If you're one, or like if it's 2 maybe grandchildren living together, unvaccinated, as long as everyone else is vaccinated, it's okay. They don't have to wear masks with their family or anything. So.
Right. And the guidelines for children are also more lenient because COVID is much less severe in children. And statistically speaking, although children can have very horrible outcomes with COVID, statistically speaking, it is a little bit riskier to take a car ride for a child than it is to develop COVID. So that's something that's been hard for me to get my brain around, trying to protect people for such a long time at home. And it's not that I want to send my kids to school unmasked, but I do want to try to keep in the back of my mind that I'm driving with them every day. So it's a similar level of severity risk at those age groups.
Mm-hmm. Yeah, and somebody just wrote down in the chat here, David wrote, we have unvaccinated children in our home and are uncertain about when it's safe for us to go unmasked when we're out. So as not to bring something home. So thanks for addressing this. And so I hope that helps. I have one almost completely vaccinated son. He's 14. And then I have an 11-year-old who's not yet vaccinated. And yeah, I haven't necessarily, I mean, I go to the grocery store. I still wear my mask in the grocery store. It's interesting. Some places of business also will say you need to be completely masked. I noticed that Target said you don't need to wear one if you're vaccinated, but
yeah, I wear my mask going shopping everywhere. Also, I think just as an added level of precaution, or maybe social cueing for everyone to make them comfortable wearing a mask. But I did go into a business this morning and the two people in the business were unmasked. And I just had to assume that was because they were vaccinated. And I think that's where we have to kind of start expanding our views is that people that are not wearing masks are free to do so. And so it doesn't mean that they're against masks. It just may mean that they're vaccinated and doing what they're told they're able to do.
Yeah. Yeah.
I think the vaccine, the mask mandate getting pulled back was really difficult because it no longer gives companies the kind of backing to try to have universal protection for everyone. So if they do have lots of employees or lots of customers who are not vaccinated, and we now have this leniency in the federal mandate, it is harder for those companies to enforce universal precautions, which then would protect all those people who have chosen not to do that. So, in some ways, I think it just took the power away from those huge organizations who could try to encourage that for their staff and their customers.
I suppose we can go ahead and just answer a question here. I was vaccinated in March. It says the vaccine expires. How soon should I get another shot? And is it safe to get another so soon? I don't think at this point the vaccine has been given a stop date.
Yeah.
I think at this point, I mean, as of right now, it is, considered still to be holding. I mean, you can even see that with, vaccination rates, are quite high, and COVID is going down. I think this is an interesting, I read this in the Post the other day, though, even though the COVID cases are going way down, if you were to actually take vaccinated people out of the equation, you're going to see that the COVID rate in unvaccinated people is actually about the same as it was during one of our peaks. So I think that's really, so even though overall the number of cases has gone down, the reason is because people are vaccinated, and the people who are not vaccinated are still actually getting quite sick. So I think that's an important feature to realize. And, so realize that, first of all, the vaccine is amazing, and it has been a complete game changer. I mean, just, look at, kind of where, compared to where we were a year ago, I mean, it's absolutely phenomenal. But it really, you do have to be vaccinated, and the pandemic is not over. We still got herd immunity to work towards. And then there's a question of whether or not we're going to get there.
Yeah, I think it's so important to realize that there are so many pockets of our region and of the whole nation where the people are suffering quite a lot with COVID, and I think we are in a more highly vaccinated region. As a matter of fact, the hospital numbers are dramatically better than they were. Last year we were following them kind of week to week and waiting for for our numbers to go down, and they were kind of sluggishly not going down, and then they went up. And at the peak, just in the ANOVA system, we had pretty close to 400 patients at a time who were all diagnosed with COVID, who were hospitalized. And in some of the better days, it was more in the 70s and 80s and 60s. And today the number is 23. So we've come a long way in our local region, and the hospital is really kind of just in much better shape because people are not as sick in this particular neck of the woods.
Yeah, I would say our region is actually doing quite well. And that's the other thing to consider, especially if you are vaccinated and say you've got unvaccinated kids at home, realizing that COVID is still out there, but it's not circulating as it was when before we weren't vaccinated. So the chances are quite,
the percent of positive tests last week in Arlington was less than 1%. Meaning less than 1% of all the people who got tested were positive.
Yeah. So we're in pretty good place. And I think, let's see, we've also got another, so we can go. I have a friend who had COVID last July. He's 59. He's uncertain if he's protected by his own antibodies and how long that will last. He was wondering if he should get the vaccine. Get the vaccine.
So yes, you should get the vaccine.
Get the vaccine. Do not rely on your own antibodies. That's, we don't have data actually that you can't get COVID again. The level of immunity and the robust nature of the vaccine in making us not get COVID is thought to be higher than the actual disease itself. I suppose it depends on the severity of the disease, but yeah.
And those people who have had COVID before and get vaccinated have a tremendous response to the first vaccine. So they may be very, very well protected after only one vaccine, which doesn't mean don't get both. I would suggest getting both. Absolutely. That's the smart thing to do. But that person does have some level of immunity, and certainly he's better off than a person who's never had COVID before. We don't have any idea how long that will last. There were certainly people, they were rare, but there were people who developed COVID for a second time during 2020 and died the second time that they got it. So that's not an understatement to, encourage your friend to get the vaccine.
Please get the vaccine. There's no reason. Just because you've had COVID before, doesn't mean you shouldn't get the vaccine. So, so let's talk a little bit about, about unvaccinated people a little bit here. There's a question, will it ever be safe for unvaccinated people to not wear a mask? What's the data showing us? And will we ever reach a herd immunity state? It's a tough one. Usually with herd immunity, we need to get to about 70% of the population being vaccinated. I think right now, I haven't looked at what the figures were. I think it was maybe about a week ago, it was about 40% in the United States has both vaccines, maybe about 50% has at least one, but it's also very regional. Like some areas are, very high vaccinated and other areas are very low vaccinated. And we're kind of getting to a point, you'll see here in the beginning, you remember how we were all scrambling, it was like the Hunger Games trying to get a vaccine. Now it's like, there's like, giving away lotteries and, just basically giving away the vaccine, begging people to get it. So you can see we've kind of reached a point where the people that are going to get the vaccines got them. And now we're trying to reach the people that are a little bit harder, I think, at this point. Now we've got the kids that also, they're also a good, they're adding it to our numbers as well. But
yeah, I think there are a lot of people that are they're still just waiting to feel just a little bit more comfortable before they've gotten the vaccine. And some people really just haven't taken the time to take time off work or to get organized to figure out how to get it on a Saturday or a Sunday, because it's really available all the time. Or they feel fearful that they're going to get a fever or body aches the next day, and they really don't want to take a day off. So I think we just have to help people trust that this is going to help them feel better and stay better for the long run. And just, continue to hear people's concerns, and so that hopefully we can answer them, in a scientifically sound way. But I think the people that were just waiting for more data can now be very comfortable that there's millions of people worth of data, which is better than we've had for all of the vaccines.
Yeah.
That probably all the vaccines we've mandated our children to get have never had this much data.
No, I mean, we have just an incredible amount of data, and the data that's in is, I mean, these vaccines, I mean, they hit it out of the ballpark with, how effective it is too. So, which is great, which is what we needed for the, how severe this condition was. Robyn, do you have anything to add? I don't know if you've been, if you've, either worked with clients who either are not getting vaccinated or are concerned about maybe people around them that aren't vaccinated who won't get. What is your feeling? What are some of the thinking around that?
So I think that my experience is kind of indicative of where we live and what this is, that every client we have that has shared with us is vaccinated. So it is interesting that where there's an option. There are people who are anxious around, is the vaccine going to be good enough? Is it going to work? When are the booster shots? Will I need it? Whether or not vaccinated people are going to be able to carry the virus to unvaccinated people. And a lot of it too is trust, right? So my practice works with a lot of people who've experienced trauma. Now, little side note that everyone has experienced trauma probably now. So there's nobody who doesn't fit into that category. But trauma survivors have trouble with trust in general because their trust has potentially been betrayed or violated. So then we're dealing with trusting people, trusting scientists, trusting doctors who we don't know, trusting researchers. Is this really going to be good enough? Well, there's this one, story of this person who got the vaccine and X happened or Y happened, and, kind of waiting for the other shoe to drop of, is this going to be good enough? Am I going to be the person who has the negative side effect, or it's not going to work? And so I think I just think there's a lot of anxiety. There's so much that has changed. It's been like whiplash with, right, what happened, where we were at the beginning of 2020 and where we are now. And, I think we're so lucky to have the science that we have and the vaccine, and to be able to, right, regain life the way we want it. And I think COVID has given everybody a reset. So sort of like you said earlier, that things have started to speed up. People now get to make a choice again, right? Do you want to go back to this level of intensity, this level of scheduling? Do you want to take that back, or have you enjoyed some of the calm time, right? The slower time, and that feels really good. And so part of COVID is, I don't want to give that up, right? I don't want to give up, wow, this ability to work from home, right? I don't have to get dressed, or what does that look like? I also think there's a lot of things that came with COVID too, right? People used food, they used alcohol, they used drugs, they used things, isolation, right, to manage their fears, their anxieties. And now people are seeing each other again from more than like the neck up, right? And we get to like see, I don't know about you guys, but I was like, oh, I am going to wear like all my clothes again, right? Like I was still going to the office every day. So I was dressed, but I hadn't put on heels in 16 months or so, because I was like, yeah, I can wear flip flops to work. But right, like it's a matter of just kind of picking the things that you might enjoy and noticing the things that make you anxious. But I think the vaccine, I mean, I'm all for getting vaccinated. I got a couple of masks actually that came in the mail today that say, I'm vaccinated. This is for those of you who aren't.
Oh.
Right? Like I'm still wearing this for those of you who aren't. Like, let's just try and make sure that everybody can be safe. I feel like this is an opportunity to really take on this feeling of community and helping each other and taking care of everyone, right? Like, and so that feels really wonderful to me. That's a great byproduct.
Yeah, and something I think we could go into is it's one thing when maybe 70% of our local community is vaccinated and making decisions here, and then what happens when you go to other parts of the country to visit your family or your extended relatives or friends, and there's a mixed group. We have tons of patients who have these situations where somebody's not vaccinated and they're just wondering, what risk do we pose to those people who are unvaccinated? Is it safe for us to be around those who are unvaccinated? And I think in the case of those people in our practice who are vaccinated or anywhere, it's very safe to enter into those environments ourselves. It's very, very safe for an unvaccinated person. Remember that whole green stripe along the list of activities. You can visit your great aunt Peggy, who hasn't gotten vaccinated yet, or anybody else. I think the question is whether a gathering would then bring people together in a group who would then expose each other to each other. Um, so and then kind of how do we talk about those conversations with people, because of course the vaccination has gotten a lot more weight than its scientific value and it's a hard thing to talk about in certain families where people have kind of a mixed set of perspectives. And um, Cecily and I were talking earlier about just recognizing that sometimes if people are on such opposite pages about the vaccine, even if the science is absolutely uh, inarguable, that it might be better to find a connection point with those people that's not really about whether or not they're vaccinated, so that there can be some kind of bridge through those families to maintain a connectedness with those people that are feeling really differently.
Yeah, yeah, and again, so I mean, we even had a question that came in here. Any guidelines for visiting relatives in another state who do not want to get vaccinated? Do we limit the visit to an outdoor restaurant, an indoor restaurant, wear a mask during the visit, and then certainly no hugs, right? And so for the person who's vaccinated, you can do all of that, right? For the person who's unvaccinated, they probably should be wearing a mask. I mean, if you maybe an outdoor restaurant, few people, I think, the unvaccinated person doesn't necessarily have to wear a mask. However, indoors, absolutely. So what if that unvaccinated person doesn't wear a mask when they go inside, or you got a big family gathering? That's a tough situation to be in. I mean, you're only in control of what you do. You're not necessarily in control with what they do, right? Your chance, if you're vaccinated, your chance of giving them COVID is very, very low. However, in that restaurant, if nobody's wearing a mask and let's say 20% of them are not vaccinated, there could still be COVID flowing around. You who's vaccinated are not going to give your relative COVID, but somebody else in that restaurant could. So I think that's, it's a tough situation. I know we want to keep our family members safe, but we've done our part by getting vaccinated, and you are keeping them safe by being vaccinated and being around them and being vaccinated. That's probably one of the safest things that you can do for them. Are you going to be able to get them to go out and get the vaccine themselves? Or are you going to be able to get them to wear a mask? At the grocery store? I don't know that, but that's kind of out of our control. And Robyn, you probably have had that conversation too, with kind of stick with what you can control.
A lot. And a lot of the conversations that Natasha was talking about too, sort of family members who just aren't able to see eye to eye. How do you have these conversations? How do you maintain these relationships? How do you find the things you respect and you love about these family members? And at some point, we can only say, here's the science behind the vaccine. I would really love for you to get the vaccine because I worry about you and I want you to be safe. But there's not much more that we can do. We can't force people to get the vaccine if they're not interested. And again, I think some of it comes down to trust, to anxiety, to the messaging that you're listening to, where you're getting your information from. right? Like, so it has to be everyone's comfort level, right? And that's what we're coming back to, and to work really hard to try and keep judgment in check, to be able to be, compassionate, and to the people who aren't getting it, and maybe try and figure out why, right? Like, what's their good reason for it. And, instead of a power struggle of, I think you should do this, and no, I think you should do that. I think that, it's a powerlessness that people might feel with family members or people they love, and that's hard for everybody.
Mm-hmm. Yeah. Yeah. I mean, there's a few other questions that came in here. Our choir practices are set to begin in late August indoors. All members must be vaccinated. Is this risky or relatively safe? Do we need to wear masks? If you're vaccinated, no. You can sing, you can dance.
Yep, the choir
You can
director
hug.
read the right guidelines. Yeah.
Yeah, making sure they're vaccinated. If someone who's not vaccinated is coming to choir practice, that's another story, right? Because we all remember before we were vaccinated, singing, projecting your voice, and especially indoors. I mean, that was, a great way to get COVID if it was floating around. But, now, I mean, it's a different story. So, and here's another interesting question. Are there guidelines for summer camp dances, maybe in kids that are not vaccinated? I know that some families are planning to send their kids back to camp. And not all their kids are old enough at this point to be vaccinated yet. But, what's safe for them at camp? And, a classic camp, singing around a campfire versus indoors. So, from what I've read, the camps, hopefully most of the camps are keeping their activities outdoors. And I've heard that they're trying to keep kids in cohorts. So basically, instead of, a huge number of kids all together, they're going to keep them in cohorts. And they're still recommending, most camps should be recommending that if children are not vaccinated, that they probably shouldn't have large amounts of kids singing, dancing together unvaccinated. Even if they've, some of them are requiring that they get COVID tests beforehand, but it's still not something that's really recommended. And we're still, recommending hand washing, and just general considerations for that. But
yeah, I'm just double checking this, but there is no mask mandate for children outside anymore, though they really don't have to be wearing their masks just in public play settings. So like at the playground, for example.
mm-hmm.
So because the risk for children contracting severe disease is lower, I think the guidelines for them are more lenient.
Yeah. We have a question. Is there anything vaccinated people should avoid? I think that is check yourself. I think from a scientific standpoint, no. If you are not ready to do something and it creates too much anxiety for you, then you're probably not ready to do it. So a lot of it, I mean, it's a complicated question. I mean, Robyn, would you agree with where I went with that?
Yes, I would. And I think that, right, it's just important to notice what's going on inside of you, right? To be really present inside your own emotions, to be really present in what's going on, to pay attention to that anxiety, and to notice the range for it, right? If there's nothing that vaccinated people should avoid according to science, right? And yet you're feeling fear, does that lessen over time? Does it not lessen over time? If it's not lessening and the requirements are still low and nothing's changing, right? Maybe we need to look at that's maybe more anxiety and it's sticking around versus just, I'm still not sure yet that this is what's happening.
It's okay to get your feet wet. It's okay to be slow about it. It's not like, the day, what was it, May 28th, I think, I don't even remember when this came up. Yeah, I don't remember which day it was.
I don't know what the day was.
I don't know what it was, but it was very sudden. It seemed very sudden. It was sudden, like one day the CDC is like, wear your mask everywhere. It doesn't matter if you're vaccinated or not. And the next day it's, if you're vaccinated, you don't need to wear a mask.
Mm-hmm.
And it was, Okay. And so, I, what again, that's just, we have to, I had to ease into that a little bit. And I trust science. I read, I know how effective this vaccine is, but emotionally, was I ready to be walking through Target without a mask? No, I wasn't. I needed a little bit more time with that.
Yeah. And I mean, I also think it's important, right? So we're moving slowly when it comes to COVID, but I also haven't had a cold in 16 months, right? I haven't had anything. It helps with the allergies when you're, I don't know that I ever want to give up my mask on like public transportation in a grocery store, because
I was on an airplane yesterday, and it feels great. It's
to have a mask on.
Yeah, you're not going to catch a cold. There's no flu. You're not going to get the chicken pox or nothing. So, so it's probably safer than it's ever been.
Yeah, I think so. And actually that somebody just wrote, Margaret just wrote, is it safe to fly? Is it safe in crowded airports? Again, if you're vaccinated, it's safe to fly. It just is. And honestly, on airplanes, I mean, since they still mandate that everybody wears a mask, it's probably one of the safer places to be, rather than, in the grocery store that doesn't require masks.
Yeah. And the air filtration system on airplanes is spectacular. And so all along, I think we've wanted to be careful about airplanes because we sit next to each other for a long period of time. And certainly there are instances where people sitting next to each other in unvaccinated 2020 were catching COVID from each other, or sitting a couple seats away. And, but I think now that everyone has a mask on, it's probably not that dangerous even for people who are unvaccinated, because everyone's covered. But certainly for those of you who are vaccinated, you're going to stay covered anyway, because it's an FAA mandate. And so is everybody else on the plane.
Let's see if there's any other good questions here. During the pandemic, we definitely did not want to hug anyone. However, vaccines have been out. And is it okay to start hugging family and friends? And how do we feel comfortable about it? How are we going to feel comfortable about doing it? So hugging, yeah. I mean, if you're vaccinated.
And the other person's vaccinated and is mutually consensual.
Well, and that's the thing. I think and I think that you hit the nail on the head right there, right? Because not only that, but maybe that person who is vaccinated, who even to say it's safe to hug, that person may not be in a place where they're ready to hug for a while. That person may not be in a place where they're ready to shake your hand. That person may not be ready, in a place where they even want to take their mask off. So I think, and so what I think we mentioned this, we've have seen patients in exam rooms, and it's a conversation. How do you feel about taking off your mask? I'm fully vaccinated. You're fully vaccinated. How do you feel about that? And if you're not okay with it, then that's fine. So I think there's going to be a lot of kind of feeling how other people, where they are, where their headspace is around these activities that we've been basically told don't do, otherwise you will die. I mean, it's just like Robyn was saying. I mean, it was traumatic. What we went through was extraordinarily traumatic.
And that changes the nervous system, right? Trauma changes the nervous system. So the hypervigilance that people are having makes sense, right? It makes you more aware. It makes you more hypervigilant around what's going on and who's around me and do they have masks on. And so just noticing that right now makes sense, and that hopefully that will come down again, right? Hopefully that will get easier.
We did have a couple of funny moments trying to kind of re-normalize things in the office. A lot of times the doctors will meet around a conference table, and at one point a month or so ago, when we all had our masks off, we realized we all have teeth. We haven't seen each other's teeth in a year and a half. So, there's little funny delights that never used to be delightful that seem amazing.
No, it's great to see people's full faces. I've almost forgotten what some of my patients look like.
Right.
Although sometimes with telehealth, it was nice.
Right.
You were able to, kind of remember that. But so getting back to travel, you know, I don't know if there's a question about travel suggestions, how to prevent COVID and preparations. Again, if you're vaccinated, you've done your due diligence in preventing COVID, so that's fantastic. And then, but you know, there are different places. Obviously, there's some, like we were alluding to, there's some places in the country that have more COVID. You know, than others, less vaccinated people. And so you can actually go to there's a website that I found on the CDC where you can actually put in the name of the location of where you're going, and it'll actually kind of bring you right to the public health site, and it'll tell you sort of what's going on, if there's what the mandates are in that place. So you can also prepare yourself, because there's some places that have no mask mandates, and there's some places that might continue to have mask mandates. It really depends on the businesses.
Mm-hmm.
So
I would be mostly worried about creating situations where unvaccinated people are drawn together.
mm-hmm.
And just because you as a vaccinated person may feel safe, if you're creating a situation where lots of people who've been hesitant to get the vaccine are going to be congregating, it won't be safe for them. And I think that's where pockets of the of even DC and some pockets of Southern Maryland and pockets certainly all around the country are still very, very impacted. Like Dr. Havert said, that I would be cautious about, you know, feeling great about having a big birthday party or a big reunion in a place where there are so many people who aren't vaccinated, because even if they feel like this isn't their thing, they're still at risk for what COVID brings.
It's like that social responsibility, right?
Mm-hmm.
You're still kind of trying to lead by example a little bit.
Mm-hmm.
So, you know, even though you're safe, we still do have, at least I feel that I have a social responsibility as a physician to take care of others. And so, you know, that's not like we're ripping off our masks and running around and say, oh, we can do whatever we want. I hope I'm not coming across as that. But it is liberating that when knowing that you have the vaccine, that you can actually start to move towards feeling like you can function a little bit closer to what normal was, at least.
And if you do have family members who are considering getting vaccinated, but they're not ready yet, then really, really listening to them about what their concerns are, and then asking them if they're open to some of the CDC's answers about that, may be a place to start. But I think the most important is really having people feel heard, that, you know, for whatever that reason is, that they might need more time, that they really are really well understood before they're tried to be redirected.
Yeah. One other thing I wanted to talk about, because this is actually a question that I've actually gotten quite a bit in the office, is the asking about how effective the vaccines are in immunocompromised people. And this, not only people who, you know, people are on medications that make them immunocompromised, not just really, really sick people. But there is, you know, and, you know, the jury's still out about this, although the CDC and other health experts have surmised that potentially these people may not have gotten as robust of a response to the vaccine. And you know, they have some protection, although potentially not all. So that's another level of you know, kind of check your tolerance a little bit for these patients. You know, they ask, well, you know, I'm on these medications, and you know, you might have to consider yourself maybe not 100% completely vaccinated, and maybe, you know, wearing masks a little bit more frequently than one would if they weren't necessarily immunocompromised. Sadly, we just don't know. I've had people ask me, should I get antibodies checked? And the answer for that is no. The antibody tests that we have are kind of a positive or a negative. It doesn't test how immune you are. We're just sort of limited. So unfortunately, we don't have that. The ability to check your immunity status. It'd be great if we could.
We will eventually do that, because
that's
a very common thing to be done for vaccination status of other vaccines.
Yeah, and I think that's the important thing to realize too, is like with these vaccines came up very fast. The data and the research is ongoing, right? And so I think, you know, getting back to the question, are we going to need booster shots? How long is these vaccines going to last? we don't know exactly.
Mhm.
Right now, they're still doing a heck of a good job on preventing COVID. So they seem to be working just fine. I
Mhm.
think what we're going to have to do is just, there's ongoing research, going on. People that were in the original trials are still being followed, right? And they're still being followed. When are any of these people going to get COVID at some point? When maybe some of these people start to get COVID, then we have to say, well, how efficacious, how long is this vaccine going to last? Then we'll talk about boosters. But right now, I haven't heard any talk about, there's in theory going to be
Yeah,
booster,
sure.
but yeah.
Yeah, we just have to wait until enough time has lapsed so that the people who have been studied now for 12 months have long-term efficacy data. But the longest people who've had those vaccines have only had them for 15 months, maybe.
Oh, I don't even know when the first shots,
Maybe,
it
yeah,
hasn't even been that long. I
maybe
don't
13
think.
months.
Yeah.
But we'll continue to collect data, every month as we go forward, and eventually we probably will be getting some type of booster. And in other illnesses that we're preventing with vaccinations, if our titers are not high enough, the standard treatment in medicine is to revaccinate. So, for example, all healthcare workers have to get hepatitis B vaccinations, and once we've gotten our series, we have our titers checked, and if our titers are not adequate to show immunity, the recommendation is for us to get that series again. And so that is a common practice in developing immunity, and so that could be something that gets duplicated for the COVID-19 virus as well.
Okay.
Question: for a vaccinated person, is there any test that would tell if we ever had COVID? Probably eventually, but
Eventually, not now.
Yeah, not now.
It's not now. Even back before we had the vaccine, checking the antibody levels wasn't all that reliable either. So it's just, we just, unfortunately, we don't have great testing for that.
Mm-hmm.
So, yeah. Well, what we can do is, if people want to continue putting messages in the chat, they can. Otherwise, I think we've got a few more minutes. If people want to actually unmute themselves and chime in, they're welcome to do that too. I don't know, you can just unmute yourself or put your hand up or whatever. I don't know if people have any more questions that either for Dr. Beauvais, myself, or Robyn. So feel free to throw anything else out there if you want to ask about the COVID vaccine or masks.
But we thought we'd go out in style by telling you guys what's safe to do now that we've been through a year of COVID, and we believe most of you are vaccinated. And we will look forward to seeing all of you again in the fall. And please come into the office. Most of you are overdue on something, so we'd really, really like to see you and make sure that we slowly get back on track. And you can make a decision with your provider whether you would like to keep your mask on or take it off once you're in the exam room with the closed door and the doctor or the PA next to you. Mm-hmm. So thank you very much. We've really, really loved town halls. These town halls were born on a phone call conversation in the middle of the night in some kind of rainstorm. Cecily and I were talking on the phone, and we thought, how are we going to get this information out to everyone? Maybe we should have a virtual town hall. And so we're so grateful for, the forced creativity that COVID threw us into, and hopefully we'll just continue this for the long term.
Yeah, no, it's great. And we'll, and hopefully we'll start to do some in-person types of things too, which is great. I'd love to get the Walk with the Doc back on board.
Yes, and the park next to our new office just opened.
Oh.
So during the weekdays, it's open from 8 to 4. And so probably we'll try to do a Walk with your Doc along the park trails as soon as we get organized to get it running. But they just opened about a week ago.
So, okay.
Yeah.
All right.
Thank you, everybody.
Thank you, everyone. And any ideas for future town halls, just go ahead and shoot us an email, and we'll see what we can do. And once again, Robyn, thank you so much for being here once again. You're just, I've leaned on you so much over the past 16 months. Even before then, but you've been just a great person and a great support
As
throughout
have
this
all
whole
of
time.
the therapists at your
All
office.
of the, exactly, not just you. You're here tonight, so I can thank you personally. But yeah, and a big tip of our hat to all the mental health professionals out there who have really had to support a lot of hard situations.
Mhm.
So okay, all right. Well, thank you so much, everyone. We'll see you in September.
Thanks.
Bye.
Bye.